Welcome. I am Terry Tropin, and today I'll be discussing the 2023 updates for ICD-10-PCS codes, including changes to guidelines and code tables. Remember that the 2023 updates are actually effective October 1, 2022, so we need to get familiar with them as soon as possible. So first, let me tell you about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus in Maryland. And I have an RHIA and CCSP certifications. I'm also an AHEMA approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I also have written books on coding. These books are study guides that help the student or a coder out in the field, kind of summarizes all the information. My books include one on E&M coding, ICD-10-CM coding, ICD-10-PCS coding, and these are available on Amazon. The 2023 versions of the CM and the PCS books are already up there on Amazon. So you can see the link to them in the description of this video. If you would like to purchase a copy of the slides for this video, give me a thanks of $5 or more and comment with your email. The thanks button is underneath the video. I will then send you a PDF of the slides. Okay, so this is an overview of the presentation. I'm going to talk about changes to guidelines for detachment procedures, tubular body parts, and devices. Also, one section, the laser interstitial thermal therapy, has been moved from the radiation therapy section to specific medical and surgical tables. Also in the medical and surgical tables are changes to heart and great vessels replacement procedures, lower arteries, occlusion procedures, gastrointestinal transfer procedures, and head and facial bones removal procedure and revision. Also outside the medical and surgical tables, there's some changes to extracorporeal or systemic assistance and performance, imaging section, and lots of changes, as always, to the new technology section. Okay, so let's start with the changes to the guidelines. So for the detachment procedures, we have a new guideline, B3.19, and this is what it says. The root operation detachment contains qualifiers that have been used to specify the level where the extremity was amputated. This is only used in the anatomical regions, upper extremities, lower extremities. These qualifiers are dependent on the body part value in upper extremities and lower extremities body systems. For procedures involving the detachment of all or part of the upper or lower extremities, the procedure is coded to the body part value that describes the site of the attachment. So here's an example. An amputation at the proximal portion of the shaft of the tibia and fibula is coded to the lower leg body part value in the body system anatomical regions, lower extremities, and the qualifier high is used to specify the level where the extremity was detached. Now, this was added to the guideline in the front of the PCS book. It was also before it was only in the medical and surgical section for the anatomical regions, lower extremities and upper extremities. So they've kind of taken upper extremities and lower extremities and combined them into this one chart. You can see the body part says upper arm, lower leg, and the qualifier. So the qualifier 1, the definition varies whether it's in the upper extremities or lower extremities, of course. And then you have high, mid, low for each one of these. At the bottom of this, you see when coding amputation of the hand and foot, the following definitions are followed: complete and partial. And it gives you the specific joint that is involved. So this was only in the section for the upper lower extremities, and now it's in the guidelines in the front of the book. So a change was also made to the guideline for coding tubular body parts. The old guidelines covered tubular body parts, which included other continuous organs, tubular organs, such as in the gastrointestinal system, female reproductive system, respiratory system. The new guidelines narrow this to just arteries and veins. So the new words are underlined. The part taken out is crossed through. If a single vascular procedure is performed on a continuous section of an arterial or venous body part, code the body part value corresponding to the anatomically most proximal, closest to the heart portion of the tubular or venous body part. So here's an example. A procedure performed on a continuous section of artery from the femoral artery, which is here, to the external iliac artery, so from here up to here. The point of entry at the femoral artery, but the part closest to the heart is the external iliac body part. Now, if it's the other way around, if it goes into the iliac artery to the femoral artery, so back down the other way, you still do the external iliac artery because, again, that's still closest to the heart. So this has just made it more specific that it's not just any tubular body part, it's arteries or veins body parts. A final change to the guideline is related to devices. This is more of a clarification than a change. In the second line here, you see that no device is bolded. I want to make sure that everybody sees what that is. Right here. The classification provides the qualifier temporary and intraoperative for specific procedures involving clinically significant devices, but in most cases, you only code for a device if it remains after the procedure is completed. So it's no device remains, the device value, no device is coded, okay? So the other thing that they changed, you can see it's right here, the part that's underlined. It's interesting. If a device that is intended to remain after the procedure is completed requires removal before the end of the operative episode in which it was inserted. So it's inserted and it's the wrong size, or it breaks, or something else is wrong. For example, the device size is inadequate or an event documented as a complication occurs. So they added the words "an event documented as" to that. And they also did a bolding of both. So both the insertion and the removal of the device should be coded. So you're going to use, in this special exception, you're going to use 2 codes. Let's move on to changes to the tables. The value for laser interstitial thermal therapy has been moved. It was in the radiation therapy section, and now it is in specific body systems. It is a qualifier value 3 and root operation destruction in the central nervous system and cranial nerves, respiratory system, gastrointestinal system, hepatobiliary system and pancreas, endocrine system, skin and breast, and male reproductive system. So what is laser interstitial thermal therapy? Well, it's physical eradication, destruction of all or part of a body part using direct use of energy, force, or destructive agent. So it's a laser. Okay, a qualifier value was added to the heart and great vessel system with root operation replacement. The qualifier value is rapid deployment used for replacement of an aortic valve. This is a way to do this less invasive, quicker, meaning less time on cardiopulmonary bypass. So it's much better. So you can kind of see from the picture, put a suture in and they use the sutures to kind of guide the device into place. So it's a little closer, little easier. The interesting thing about this is that now this is coded in the new technology section. So it was moved from new technology section to the heart and great vessel section with replacement. Okay, so this is a big change, and it's in heart and great vessels. instead of new technology. Okay, let's look at lower arteries section, occlusion. So this is qualifier values were added to the table for lower arteries, root operation occlusion. Body part values for right and left internal iliac artery, qualifier values for right and left prostatic artery. The catheter is inserted into the iliac artery and moved into the prostatic artery. So you have iliac artery and it is moved to the prostatic artery. So remember, occlusion is completely closing an orifice or lumen of a tubular body part. So this is completely closing it. So this is iliac artery, right and left. The qualifier values prostatic artery, right and left. Note that so they added the prostatic artery. Okay, so qualifier values were also added to the gastrointestinal system table for the root operation transfer. So let's remind ourselves what transfer means. Transfer is moving a body part to take over the function of all or a portion of a body part of another body part, while the part moved remains connected to its original vascular and nervous supply. So it's moved, takes over the function of a different body part, but it still remains connected to its blood vessels and nerves. So this is transfer. So under body part values, small intestine and large intestine, they added qualifiers. So the large intestine, a part of that can be moved to take over the function of bladder or ureters. In large intestine, the body part value can be moved, transferred to take over the function of the bladder. Okay. So device values were also added to the head and facial bone section, root operations, two root operations, remove and revision. So the body part value within here is skull, and the added device value infusion to head and facial bones removal, head and facial bones revision. So they added this infusion device. So removal, of course, is taking out the device, the infusion device. Revision is working on a malfunctioning device or a displaced device, not removing it, but just kind of correcting it, fixing it. So, okay, so that completes the major changes in the medical and surgical section. Changes were also made in the extracorporeal or systemic assistance and performance section with the body system cardiac. In this body system, a new row was added using the function value oxygenation and the qualifier value supersaturated. Okay, so the added function value oxygenation, qualifier value supersaturation, but they deleted supersaturated from the body system value circulatory. So it was removed from circulatory and added to cardiac. Now remember, assistance is taking over a portion of a function by extracorporeal, outside the body means. Okay, so changes were also made to the imaging section for MRIs. A new row was added with a qualifier value hyperpolarized xenon 129. This gas is used to image lungs without exposing the patient to ionizing radiation. So a non-radiation way to image the lungs. This is for bilateral lungs, the body part, and the qualifier value is the hyperpolarization xenon 129. And you can see how this kind of looks from the picture. Many, many changes were made to the new technology system, as has pretty much always been the case. So let's start with the new technology nervous system. The root operation is insertion. So the body parts for this is a totally new table. It has the body parts, sphenopalatine and vagus. So these two, one's a ganglion and one's a nerve. So for these, they added device substance technology value, neurostimulator lead, and neurostimulated lead with paired simulation system. So this is where the palatine is, ganglion is, and this is where the vagus is. You can see from here, the pulse generator is here, and the leads go up into here. So that's what we're talking about. Also in new technology, nervous system is a other procedures surgery operation, okay? So this is a new table, X0Z, operation other procedures. The body part value is the prefrontal cortex, and the device substance technology value is computer assisted transcranial magnetic stimulation. Okay, you can see kind of from the picture what this is. This is used to treat neurological disorders and to study and evaluate patients' cortex. So I love about coding. You get all these, find out all these interesting things that can be done, the new stuff that can be done. Okay, so that's for the nervous system. A new row was also added in the new technology section for the cardiovascular system, and this is for assistance. So this is a table that already existed. They just added a new row. The body part value is coronary sinus. The device substance technology value is intermittent coronary sinus occlusion. So closing, reopening, closing, reopening. So the coronary sinus is the area where a collection of veins join to form a large vessel. And there we go. Let me find that again. There we go, right here. And that shows it's this one. So a device is placed in the coronary sinus, which intermittently increase the coronary sinus pressure and coronary sinus pulse pressure. So intermittent occlusion. So a new table was also added to a new technology for the hepatobiliary system and pancreas, and the root operation is destruction. So this is for body part values for the liver and for the specific lobes of the liver. The device substance technology value is ultrasound guided cavitation. So cavitation. Cavitation is physical force of sound waves on gases to destroy tissue using heat. So it heats up the gases and it helps destroy the tissue. You can see in here that this is destroying a tumor. Here's the ultrasound part here. Let me get that here. And this is what it's destroying here. So for new technology, skin, subcutaneous tissue, fascia, and breast, this is something that was deleted from new technology. The device substance technology value is skin substitute, porcine liver derived. And this is what was deleted. This is in skin, subcutaneous tissue, fascia, and breast, root operation replacement. Now this is interesting because they deleted the row for skin, device substance technology value, the porcine liver derived substitute. The remaining values on this table are very different than that. They're not porcine liver or living tissue. These are bioengineered allogenic construct, tissue developed by cells from another individual, not from a pig. These are used to treat deep partial thickness thermal burns. Now, if you go to, say, well, gee, what are we going to do instead of this? How are we going to replace this? If you go to the device key, you can look up porcine, and it says use zooplastic tissue, but it refers you to the heart and great vessels. Okay? And there's no comparable code in the skin and breast section in the medical and surgical section. So that's kind of interesting. They completely got rid of the porcine for skin, and these only for heart and great vessels. Okay, table XK0 in new technology has been deleted. This table was for device substance technology value for introduction of concentrated bone marrow aspirate. Okay. This was for muscles, tendons, bursae, and ligaments introduction, concentrated bone marrow aspirate. So what are you going to do instead? Well, if you look up in the substance key, it says use substance value other substance. If you look up in the index bone marrow, it'll refer you to 302 in the administration section. So this table 302 includes substance value for stem cells and bone marrow. Okay? So this is performed to improve healing, reduce inflammation, things like that. So it's no longer in new technology, it's in the administration section. So there's a new technology table, XKU, that is for muscles, tendons, bursae, and ligaments. This was changed. There's a new table. Body part values, upper spine bursae and ligament, and lower spine bursa and ligament. So the important part of this is the device substance technology value, posterior vertebral tether. Okay, so you can see on here, it's easier if I mark it up. You see this construct that's kind of put on here. This is before this very much curvature of the spine. They put this construct on, and as the child grows, it straightens. So this is how it is originally, and then 2 years after surgery, you see that it's really straightened it up a lot. So it's actually pretty neat. So this is posterior vertebral tether with a value of 6 in device substance technology. A new table was also added to bones, and a table in joints was revised to create codes for internal fixation device with tulip connector. So tulip connector, you see how this little opening here, and then it's kind of with a little U-shaped or tulip-shaped as they're looking at it. So this was a device substance technology value, added internal fixation device with tulip connector, and this was added to new technology bones insertion and new technology joints fusion. And these are for, the first one, bones, was for pelvic bone. The joints was sacroiliac joint, right and left. So this, why use a tulip connector? Well, it includes a pedicle screw for anchoring in the bone, and you can see it can put this rod here, fits within the U-shaped part of it. Okay, so it's interesting that the table for bones uses the operation insertion, the table for joints uses the operation fusion. So another new table for joints in new technology is also insertion, and this uses body part values, lumbar vertebrae and joints and lumbosacral joint. And the device substance technology value is posterior spinal motion preservation device. And this is to open the spinal canal and foramen, the opening, to ease pain and allow for movement. So this is an alternative to fusion, because of course with fusion, once it's fused, there's not that much spinal movement. But if you look at the first picture here, you can see that there's some flexion, rotation that is possible with this device. So it's a good alternative to fusion when appropriate. So here's another table in new technology joints. This is one for the operation replacement. So you have body part values, knee joint, right knee joint left. The device substance technology value is synthetic substitute lateral meniscus and synthetic substitute medial meniscus. And so these are synthetic substitutes for the meniscus in the knee, lateral meniscus here, medial towards the middle there. Now, also in the new technology section are many new substances and some new devices for treatment. So I'm going to kind of group all of these together and just some of them are introductions, some of them are infusion procedures, but I'm just going to group all of these together just to let you know what we have. So we have a drug used to prevent catheter-related bloodstream infections. We have one to treat C. diff infection, one to analyze gene expression for infections such as HIV and hepatitis C, cytomegalovirus after transplant, and Epstein-Barr. Those are for infections. Now, there's also some new ones for treatment of cancers. So we have different kinds of cancers. Liposarcoma and sarcoma, multiple myeloma, large B-cell lymphoma, blood cancers, and multiple myeloma. So these are new drugs that in the new technology section. And here are other new values in new technology. One to treat thalassemia, congenital athymia, neuromyelitis optic spectrum disorder, stem cell therapy, autoimmune conditions, and a drug given prior to bone marrow transplantation. So a lot of new ones, as happens every year. And these all have new technology value 8 as the qualifier. Okay, so here are some final new technology values. We have a device substance technology value, brain electrical activity, computer-aided semiologic analysis for analysis of seizures. Coronary artery flow, we have 2 different ones for that. Quantitative flow ratio analysis and computer-aided valve modeling and notification. So, new devices. Okay, so that completes this video. If you have questions or comments, please feel free to contact me. If you'd like to purchase a copy of the slides for this video, give me a thanks of $5 or more and comment with your email, and I'll send you out a PDF of these slides. So on Amazon, I have the new 2023 books for CM and PCS. Those are already up there, and the link to that is in the description of this video. The evaluation and management coding book update will be available in the fall. I don't quite have it yet. I haven't actually even looked at it yet. So if you have any questions or comments, please let me know. And thank you very much for listening. Thank you.